This lecture is on bone types. We've already seen how bone is grouped based on development, which was the intramembranous versus the endochondral. We're now going to look at how bones are grouped based on shape and location. So long bones. Long bones are basically longer than they are wide. This photograph is of, or this drawing is of a humerus. They have the epiphysis and on each end and the diaphysis. The bone lecture on endochondral ossification was all about long bones. They have a bone cavity, which is also called the medullary marrow cavity. Long bones include the humerus, radius, ulna, metacarpals, which are the bones of your hand, not the bones of your wrist, but the long bones of your hand, and the phalanges, which are the bones of your fingers. And the lower limb, the femur, the tibia, the fibula, the metatarsals, which are the long bones of your foot, not the ankle, but the foot, and the phalanges of your toes. The key to remember is that even that last digit of your little finger, which looks very short, is still a long bone. Short or round bones include the carpal bones, which are the wrist bones, and the tarsal bones, which are the ankle bones. They are round, they do not have a diaphysis, and they form pretty much the same way the epiphysis forms in the long bones. In fact, they are slightly later, like the epiphysis is secondary ossification. They have later, and if you do a radiology x-ray of an infant's wrist, it will look like it's still mostly cartilage. So we have that. We also have another very special short bone known as the patella. The patella is a unique round short bone because it's also called a sesamoid bone, which means that it grows within the tendon. This is going to help stabilize the tendon for movement of the knee. The other sesamoid bones are the little tiny bone in your wrist bones, your carpals, called the pisiform. And sometimes people will form small sesamoid bones in the tendons around their knuckles or in their feet. If you've ever heard somebody talk about developing bone spurs, those are sesamoid bones that developed in the tendons of their feet. Flat bones, on the other hand, have that layer of dense bone. This is the picture from the skull again. Have a layer of dense bone on each side with spongy bone in the middle. Flat bones include the skull, the ribs, the sternum. Some books may place the clavicle with this group, but remember, not all flat bones form by intramembranous ossification, or I said intramembranously. The ribs and the sternum formed by endochondral. So endochondral is everything below the neck except for the clavicle. Intramembranous is the skull and the clavicle, but flat bones include the skull and the ribs, so two different types of ossification. So flat bone is strictly about the shape of the bone or how it's structured, which is to say the two layers, the spongy between. We also have irregular bones. Irregular bones really don't follow the given shapes or patterns. The body of the bone will form a lot like the round bones because they're fairly round. They're mostly dense bone on the outside with spongy bone on the inside. We have things like the spinous process, which will form very much like a flat bone. So these are called irregular. This includes the vertebra, the os coxa, which are your hip bones, the scapula, which was your shoulder blade, the hyoid, and the mandible. The interesting thing about the mandible is actually it does have a marrow cavity for the nerves and the arteries to get to your teeth. The other way we have of grouping bones is by regional. The axial skeleton is the core of the body. You can think of it as your torso and your head. It includes the skull, the vertebra, the ribs, the sternum, and the hyoid. This unit is going to focus on the vertebra, the ribs, the sternum, and the hyoid. The skull will be unit 3. We put it in its own space because it's so specialized and there's so many things to learn about it. We don't want to confuse you, so we're going to basically focus on the ribs, the vertebra, the sternum, and the hyoid. The appendicular skeleton refers to the limbs, and I've given the complete list of the limb bones here. But the key here is that the scapula and the clavicle and the os coxa are appendicular, not axial. They attach the limbs, scapula and clavicle attach the upper limb to the body, and the os coxa attach the lower limb to the body, but they are not part of the axial skeleton. They attach to the axial skeleton.